Good morning. My name is Michael Bednar. I'm with the Center for Fiscal Equity. These are my comments by video, which are for the public and for members and staff to supplement my written comments to the Committee on the Budget, which I'm emailing. Hopefully they'll be read for fiscal year 2023 budget priorities. I'm cheeky enough to make comments, as if a member, but I am sending them to my member, Representative Raskin, who's not on the committee. So, requesting that he forward them. Some of these comments, for the record, are based on hearings earlier this month. Also on the hearings on how women can thrive in the post-pandemic economy. I've also commented on the DoD and HH budgets in the interim. Basing my comments on the very excellent staff paper on the president's budget that the committee staff has done. It's just, it's every year it's, saves me slogging through, 10 books, which I look to anyway. I mean, I'm a budget geek, so I enjoy looking at these things, although usually online and, it's expensive to buy the attachment. So, anyway, the fluid state of the war in Europe and in our inflationary economy will require changes on the fly, as will the inevitable crash of asset markets, which has already started. I will attach an analysis of the latter. It's called Depression 2022. The thing that stands out is that inflation is largely caused by an out-of-control, bubbling and ballooning oil futures market at NYMEX, which was deregulated by the Trump administration, not by pandemic shortages or foreign policy or anything that happened under President Biden. This was a fully and squarely a Mick Mulvaney episode, and it's going to be go badly for us. So last year, money added to the system because of COVID kept the economy afloat artificially. With the money train stopping, the pressure from overfed asset markets will explode. I mean, it's going to be, if I'd have tried to sabotage the economy, and maybe Mulvaney did, I could not have done a better job than Mick did. Hopefully he didn't try, because he was assuming he would still have a job. So, he's just an idiot. But, just talk to some of his friends. Some of you are his former colleagues, so he's not the smartest tool in the shed. So anyway, the best budget is one that helps working families. Generally, the 75% of tax filers whose AGI is under $85,000. Do right by them, and the economy will recover. The next 16% are those households making up to $250,000 don't need much help. The top 4% need to start paying much more, especially because they also hold most of the assets backed by the public debt. Taxes need to be high enough so that we no longer have to borrow from those rich people, and so we no longer have to roll over the interest we pay to the very same people. So continuing as we have is madness. Please see the attachment on debt ownership for more information. How to channel more money from the speculation sector into household consumption through governmental purchases, salaries, transfers, and contractors, and then to the private economy is addressed in the attached tax reform plan. Switching from taxing capital gains and returns in personal income to an asset value added tax and subsidies for offsetting salaries with losses. In essence, subsidizing failure and bad speculation. Just this one change will unshield $1 trillion in loss write-offs, half of which often offset high salaried income over the next 10 years. Actually, it's $69 billion a year that is salaries that aren't collected on, even though they're high salaries, because people have decided to write off their losses, which may in fact not really be losses at all. This is why we need Trump's and a lot of other people's tax returns, so we can see exactly how much they're skimming. It's a lot of money in 10 years. We talk about the tax gap, but nobody talks about this tax gap, and it's time to talk about it, even though nobody wants us to talk about it. So the release of the original draft opinion in Jackson Women's Health versus Dobbs underlies where more money is needed. If the majority opinion is maintained, women who seek abortion services because they are poor or on the edge of poverty, or who would be impoverished by ending their educations, will be forced into an impossible choice, where currently their choice is only difficult. It doesn't include seeking illegal abortions and self-induced, so that's what the choice will be, especially if subsidies for families are not increased. To not increase subsidies for work, child income, and child care now would be the height of cruelty. Build Back Better is a start, but we need to go bigger as well as better. Job one is not budgetary, but it is the thing that will make the budget work. Increase the minimum wage. Doing so and funding the increase as inflation and projecting payroll tax revenue increases takes the financial pressure off of young people saving for college or starting their careers. The working poor, which are not words which should exist in the richest nation on earth. Working poor, that's just excise that from the language by doing right by them. Families with children, the retired, and the disabled. Because as a disabled person, if you increase the minimum wage, then you rebase my salary, my benefits, and then I can afford food. Imagine that. Job two is to restore the refundability of the child tax credit, restore it to American Rescue Plan Act levels, and then double it again, and then encourage states to add to it in their fiscal system. Maybe even doubling it again. Any member of Congress or the Senate, and especially any Democratic member who consider themselves pro-life, must be held to account for opposing this kind of provision, to have a good child tax credit. Their belief that adequate family pay is an invitation to idleness is subterfuge for maintaining a pool of low-wage workers who have to work on low-wage jobs so that their children will not starve. It's like, what are you thinking, Joe? And I'm not talking about to Joe Biden here. Job three is to fully fund closing the education deficits which cause poverty. Individuals without adequate training to compete in a high-wage economy should be paid the minimum wage, which is their opportunity cost, to further their education. Anyone going to school from ESL to GED to apprenticeship and technical training to earning an associate's degree, and even juniors and seniors in high school from poor families should be paid for their class time. If such people have children, their training provider should also distribute child tax credit funds to them with their payroll as if they were working. Because frankly, education is work. I've been through lots of it, and it is not idleness by any means, especially before college. In college, you can manage your time more, but if you're in secondary school or ESL, you're being told what to do and when to do it. That is work, and it's high stakes work for some people. And clients in occupational health, in partial hospitalization for substance abuse, and psychiatric rehabilitation programs should also be paid to attend, and that's in addition to their any benefits they receive from SSDI, including and especially those in drug court who need education more than low-wage work. And when Oxford House, they talk about being a working program. Work should be education should be the work they're doing, not bookstores and God forbid bars and school. Entering into training and rehabilitation programs should be easy, unlike the almost punitive processes for applying for temporary aid for needy families or food stamps. These programs would be eliminated in favor of the reforms proposed here. Doing so will free up social welfare eligibility screening so that those resources can be diverted to case management for training participants. They will also save administrative costs to the state and local levels. The Medicaid program, as we know it, should also end. It should be replaced with a subsidized public option under the existing Affordable Care Act for poor families and for those with pre-existing conditions. Medicaid funding for retirees and the disabled who receive Medicare, also known as dual eligibles, and all others in long-term care through Medicaid should be entirely federal as a new Medicare Part E. Doing so will take financial pressure off of state governments for the foreseeable future, freeing up resources for better educational programs. Providing for adequate child care and family medical leave rounds out the list of improvements. These programs are best funded through employer-paid taxes rather than personal income tax, so that the ultimate consumers of worker labor pay the cost that the workers now bear to provide these goods and services. You know, when my daughter was old enough to go to daycare, you know, and I had to go back to work, there should have been better. You know, there was some assistance, but it should have been total. You know, my opportunity costs, and for a while I didn't go back to work because my opportunity costs would have been higher than working when I was, you know, because I was working at pretty good wages, you know, over what Build Back Better or what the Fight for 15 wants, but you know, after you pay for $900 a month in child care, you know, that eats into it a lot. So the opportunity costs are, you know, quite high. This is obvious, of course. It doesn't take rocket science. The funding for which is covered in the DoD budget comments. I mean, if you're the customer and you need somebody to wait on you, to give you coffee, give you movie tickets, to, you know, provide a support for professionals, you know, then the people who are clients should pay for those through prices, not taxes. These reforms must be scored as pro-life legislation. Excuse me. Having served on the staff of a major abortion rights organization in the past, I can assure you that no such organization would ever oppose higher living standards for women and their families. They don't like abortion that much. They like care for the women and their families. The chief obstacles for funding families is not the feminist movement. It is the so-called right to life movement, who would rather women be penalized for having abortions than subsidized so that these are not necessary. Over the course of many decades, I have had conversations with conservative members of the pro-life community. When push comes to shove, they oppose the measures above because their objections to abortion are more about sexuality than the welfare of children. Catholic Charities USA Network and the Catholic Health Association all stand with working and poor women, and especially working poor women. They must be publicly leveraged to get the U.S. Conference of Catholic Bishops behind them as well, and have the bishops insist that these measures be considered must-pass legislation for the computation of pro-life voting records. Catholic members of Congress and the President should also lead in this effort. Again, thank you for the opportunity to share these comments with the committee. As always, we're available to answer questions. And there is more information in the comments on how to do that. And of course, it's also on the hearing in the hearing notes. So, thank you much. I'll also see again our attachments on Depression 2022, debt ownership is class welfare, and our tax reform plan with video links such as this one. Thank you much, and have a good day and a good week and a good Memorial Day as well.